What's going on, everybody? It's Michael here at Home Health Success Academy. I'm back again. So today, what we're going to talk about are marketers. That's right, marketers. So, being in this industry for a while, I've actually had the opportunity to meet a lot of amazing marketers. Marketers that have been in the industry so much, producing 20, 25, 30 referrals a month, and even more. And I've also met, medium type of marketers who are bringing in around 10 to 15 monthly. Now, for every one of these great marketers, there are thousands and hundreds of really bad marketers. And that is what we're facing in this industry. So let me ask you something. If you are an owner of a home health agency, a home care company, or a hospice, or if not an owner, you're an administrator or a manager, do you have one of these bad marketers? And one of the biggest failures that agencies do is that they keep these marketers in, having this, idea, this fairy tale idea that eventually they're going to get better. And what you need to look into is that people don't get better unless they're provided more information. And I want you guys to be able to understand that if you're not seeing your marketer improve, within a 2-month, 3-month stint, and they're not producing the type or the amount of patients that you should be getting or referrals you should be getting, you need to make that jump ship mentality and get rid of them. Right? You don't want them to be stuck in your agency for so long and not producing, because they're a poison to your agency. And, I have the utmost belief that people do improve. But the question is, the quality of improvement needs to show, and what are we doing for them so that they can actually improve themselves? And this is one of the biggest things that, a lot of marketers need to understand, is they need to be able to show what they're worth to these companies, to your company. So there's a lot of marketers out there, but there's also what we call wannabe marketers, right? These are the marketers that the moment that they walk in to a person that they're trying to get referrals from, they're marketing to, and the moment they hit a roadblock, all they want to do is give them the brochures, give them their business card, right? They go, okay, here's my information. Give me a call when you have some patients. Well, that's a problem, right? Do you know that your marketers are doing this? Just because your marketer came back home to the office and brought you a business card saying that I spoke to this person, that doesn't mean that they did a good job to get these referrals. It's completely different. And our job as administrators and owners of companies is to make sure that these guys are provided the great information, but at the same time is that they're doing what they're supposed to be doing, right? You don't want to be throwing away your money out there and not getting anything in return, right? So you need to step back a moment and reassess your marketers. Are they bringing in what they're supposed to bring in on what you're paying them? Is there an ROI to it? Is there a return on in your investment? And I've come across several other agencies out there. Well, my marketer brings in 3-4 patients a month. That's the average. I pay them $80,000, a year. Okay. And, but, at least these patients that we get, okay, we can, we just either readmit them the next set, or, further down the line, we may readmit the patient again if they need more help. Here's the thing, you cannot rely on those readmission values, right? You cannot look at that number that, the patient that was referred to you for January, they're going to get, discharge in March, and you're hopefully thinking that this patient is going to end up with you somewhere around September or somewhere around October or so, again, if need be, right? Because if another home health agency jumps in the way and be able to get that particular patient, if that patient went back to a hospital, went back to a nursing home, that's going to create problems. Now, mind you, I do believe in having a secondary touch with these patients, whether they get admitted to you or you can get information from them that hopefully maybe they can refer you to another family member or friend that would need the services later on. That's another video. But right now I'm talking about these agencies that are hiring marketers of low caliber and at the same time is not providing them the proper information that they need so that they know how to market their company. Marketing process is a whole big, spectrum that needs to be looked at. And a lot of companies are concentrating on making their company better by getting the right software, getting the right computers, getting all the the whistles and all that stuff that they need to have in their office, right? They want everyone to attend seminars and webinars to be able to be good billers, to bill properly, to proper QA the information, okay? Now those are great things to do, but the problem with that is you need to spend majority of your time marketing your company because you won't be able to bill a patient. You won't be able to provide any care to patients and prove that you have great people if you're not bringing in the patients. So what I'm asking a lot of you guys out there, what I'm asking, what are the problems that you're facing with your marketers? What are the problems that you're facing with your company? And maybe I want to be able to answer the questions that you guys have. So what I'm trying to do in a lot of my videos right now is to be able to talk to you guys and maybe ask questions, and I want to answer your questions, right? That's it. I want to be able to solve the problems that you're facing right there so that if you have that breakdown, that maybe we can jumpstart your company and you can start, going past the little problems that you're facing. Okay? So if you're a marketer, you're an owner of a company, you're an administrator, you're a DON, you have any questions, shoot it my way. Make sure you subscribe to this video. Go ahead and leave me a message. I love answering questions right away. So I want to be able to open up, my link to you guys to answer your questions. So this is Michael from Home Health Success Academy. Home health marketing is not hard if you know what you're doing. I want to solve your problems. Let me know what they are, and I'm going to answer it.